Good afternoon. I'm Sergeant Terry Ellingham from the Will County Sheriff's Office, and I thank everybody for coming this month to our Manhattan and New Lenox area Triad meeting. We're very grateful for this month's educational program to welcome Dr. Sharma from the Presence Health, and he's a doctor who specializes in geriatric medicine, and I shall let him introduce himself further. So, Dr. Sharma?
Well, first of all, I'd like to say, it is fantastic to see everyone out here coming out to really get informed and get educated about more preventative health, because that's what we're going to be talking about today is preventative health, immunizations to help prevent illness, and ways to kind of keep healthy with the upcoming winter season. So I think all in all, hopefully we have a few points to take away today. And the slides I'm going to be reviewing up here are going to be in the handout also, so you can take notes and on the handouts themselves. So just a little bit about myself. I am a geriatrician out here serving our community in New Lenox. I'm brought up and grown up in the area just north of here, and really wanted to provide that service to my community, which gave so much to me. A little bit about my training, though. I did my family medicine residency at Southern Illinois University, about 6 hours south of here, the Salukis, for those of you that know. And that's where I was also chief resident, where I was honored that role by faculty and some of my colleagues also. But then I actually went further than that, and I really wanted to focus on something that I found really to be very passionate to me, something that I wanted to really wake up every day and say, you know what, I love what I do, and I really want to make sure that we treat this certain group of population the best I can. And that's what brought me to the University of Illinois here in Chicago at UIC, where I did my fellowship training in geriatric medicine. And there I was actually fortunate enough or blessed enough to receive Fellow Clinician of the Year out of all the fellows out there. But that's just a little bit about me. But I want to make sure we cover everything that you guys want, what you guys are out here today for, and all the viewers are really tuning in for also. Basically, immunizations. What are immunizations? What are vaccinations? Well, we all understand when babies are born, they have to go regularly for their shots. Well, the reason why they have to do that is because they don't have the immunity. They haven't been exposed to these bacteria, viruses, things of that sort, because they're so new to the world. And we know that there's bacteria and viruses and so many other type of infections that we come across on a daily basis, millions in fact. Okay, we have bacteria that normally live on our skin. All right, so that's the reason why we give babies immunizations, so they develop immunity. So if they ever get infected or anything goes on with them, they are able to ward off those infections because they already have antibodies towards those bacteria. Same thing goes when we grow older. Certain age cutoffs and certain type of infections are more common as we reach certain ages. And it's all been very well studied, so that's why they recommend getting vaccinations, certain ones at certain times, which we're going to go over. And these actually, although seem few, are the major ones we really want to know and really discuss, and later also answer all the questions that may be there. Because these are the ones that are going to keep you out of trouble on the majority of the cases. Okay, things like Pneumococcal Vaccine, influenza, tetanus, and I get a lot of questions on shingles. And I'm sure we're going to have plenty of those here after we talk. But we want to start off with the pneumococcal vaccine. It kind of sounds like pneumonia, right? Pneumococcal, pneumonia. Well, the reason is because a major bacteria that it's immunizing against is the Streptococcus bacteria. Streptococcus is a bacteria, you don't need to really worry about the specifics, but just understand the reasoning behind the vaccination. Because this bacteria here actually infects multiple organ systems and not just the lungs. So we understand pneumonia as being an infection of the lungs, right? Where we start coughing up, a lot of mucus, a lot of junk. We can have shortness of breath because we're not getting enough air in our lungs. We can have fevers because it is an infection, right? And it can lead on to many other things. But the basics, generally speaking, that's what it covers. Now, it does cover pneumonia. Now, is this the only bacteria that can cause pneumonia? By far, not at all. There are many, many more bacteria. But this is the most common bacteria. Okay? So you are actually immunizing yourself or decreasing your chances of getting pneumonia from the most common type of bacteria causing pneumonia. Okay? So that's why it's so important to get a pneumococcal vaccine. But in addition to the pneumonia, we have meningitis here. Okay? And what is meningitis? Meningitis is an infection of, I'd like to say broadly, the central nervous system. Think of our brain and spinal cord. They're both connected, right? And so basically, think of the brain and the spinal cord in a bag of, like a Ziploc bag, for instance, kind of surrounding it all. Well, that surrounding structure, that bag, is what's called the meninges, okay? And when that gets infected or inflamed, we call that meningitis. Typical signs and symptoms of meningitis are confusion, headache, severe neck pain, maybe even some back pain. But now again, it is an infection. So you may have fever, may feel fatigued and sluggish, okay? Some people even get so bad that they may lose consciousness for that matter. So it is a very serious illness, okay? But now again, you are being covered by one of the causes of meningitis by getting this vaccine, drastically reducing your chances of getting it. Now the next and final one here for one of the major infections that the Streptococcus pneumonia causes is also sepsis. Now, simple terms, you can think of it as infection of the blood, okay? But I want to take a step further, is that the fatality rate of sepsis is actually very, very high, okay? It is not only an infection of the blood, but the blood goes all over our body, right? Supplying all the major organs, like the kidneys, the liver, the heart, the brain. And a lot of times what happens in sepsis is these organ systems start failing. That's when you see patients on the ventilator, in the ICU, being treated with very, very strong antibiotics, blood pressure, out of range, low blood pressure. And so that's something we always want to be cautious of. And like I said, I'm not here to scare anyone. Maybe I have already, but I really want to let you know that this bacteria here is a culprit of a lot of other things than just simple pneumonia. So if you get this vaccination, you're able to actually protect yourself for other things also, not just the pneumonia. I know we commonly call it the pneumonia vaccine, right? Well, now who do we recommend get it? Should we say everyone gets it? Well, no, because we want to make sure we vaccinate the right population. The people that are most susceptible to these severe infections, okay? And they've done money research on is it better to vaccinate someone earlier, later, how often, and so it's all been well documented. And basically the consensus, the general consensus, and these are basically from the CDC guidelines, the Center for Disease Control, is that single vaccination is recommended for patients 65 and older, okay? And revaccination, meaning getting the vaccination again a second time, is recommended every 5 years in patients with other illnesses. Other illnesses including, and I like to just kind of categorize it, as illnesses that suppress the immune system, okay? Because if your immune system isn't working well, the vaccination is not working well, so you need to get the vaccine again, okay? Things like, very commonly, diabetes, all right? Other leukemias, other blood type illnesses, those are things that really people need to be revaccinated on. Patients with other immunocompromising illnesses, or for that matter, medications that may cause immunosuppression, decrease of that immune system. Things like steroids, A lot of people that are on other medications for rheumatoid arthritis. Okay, those are common illnesses that we need to watch out for. Even lung illnesses like COPD. Okay, in fact, young people with cystic fibrosis, because their lungs are so compromised, they recommend vaccination with the pneumococcal vaccine also. Okay, but all in all, I can sit here and kind of go over a whole list of things of why you need to be revaccinated and things like that. But I think it's really important that you guys understand that the need to talk to your doctor and have further conversations about whether or not you need to be revaccinated, or have you been vaccinated, or was it before 65, was it after 65? Because again, we are looking at the most serious infections that we're trying to prevent. Okay? Now we move on to influenza. This is always a fun one when I talk to my patients come flu season, because I hear a lot of stories, a lot of different things, a lot of, right here, a lot of myths are surrounding this vaccine. Okay, obviously the influenza is a virus, and the vaccination helps prevent against the flu. Okay, I'm not talking about the common cold, I am talking about the flu. And the flu most typically happens during the winter months and peaks around January through March. Okay, now there's a little trick here, because we'll talk about these next couple of bullet points here, because it's going to be important to know when to get vaccinated and why. All right, now when we look at the flu, I guess we should always start off by saying, what is the flu? How do we feel? How do we know if we have the flu? Well, first of all, and it's very different than the common cold. Common cold, you get run down a little bit. But by no means are you bedridden and really can't get up, this gives you generalized body and muscle aches and really hurting and not having a good appetite, not able to eat or drink. Really gives someone, someone feels very, very bad when they get the flu. Now, there are medications, oral medications, that can be prescribed if it is started in time. A lot of times what happens is people start getting these symptoms and they wait 4 or 5 days before they ever come see the doctor. And then at that time it's too late to start these antiviral medications, but we need to catch it within the first 48 to 72 hours in order to have that medication be effective. Okay, so that's why getting to your doctor to get these things checked out, seeing if you do have the flu or not, and getting started on the medication is of utmost importance. But how do we prevent any of this even happening is with the influenza vaccine. Okay, now I did mention there was a lot of myths about it, and let's kind of start talking about some of them that I've heard. They say, Doc, I don't want it because I got it 20 years ago and they gave me the flu. Okay? Or, Doc, I got it and, I had some other medical issue. I got it, there's a lot of pain, I got it, all that is well, okay? What I know exactly what's written in the medical literature, and that's what we've studied, is that it is definitely a vaccine that does not cause you to have the flu. Rather, you may have a slight temperature. By no means is it the flu. Okay. Reason is because we're introducing the influenza vaccine to you when we administer it, and that your body may, when it's developing immunity, may also react by causing you to have a temperature. However, it not only prevents you or decreases your chance quite a bit from ever getting the flu that season, but even if you do get the flu, it reduces your chances or reduces the duration and severity of the flu when you do get it, if you do get it. Okay? So it's not only preventing you from getting it, but if you end up getting it, the small chance that you may get it, it decreases the duration of the illness and also the severity of the illness. Okay? That's why it's important. Now, the trick to it, though, and not everyone knows this, is that after you get vaccinated, after you get the shot, it takes about a month for you to actually develop immunity to it for that season. And that's why we recommend getting it maybe in the fall months. However, you also look at the next point here, immunity lasts about 3 months and compare that to the peak of the flu season. Okay, so I figure most of my patients I like to get, as they come in October, November, because then they build up their immunity throughout December. Okay, and they're covered for the peak time between January, February, and March. Okay, now that's normally what happens, okay? But the CDC puts out recommendations and guidelines seeing the trends of how many cases are reported, and they say, well, this flu season, just this last flu season, actually was like February, March, April, like pushed forward a little bit. Some are pushed back a little bit. So that's why we pay attention to, making sure when we should get those vaccines out, okay, and get our patients vaccinated. But definitely talk to your doctor about getting vaccinated because it's so important. Now, what are the recommendations? Those of you 65 and older should get it yearly, every year, generally about the same time. Because again, even though we say yearly, it's covering you through the peak season here, January through March, and it only lasts 3 months. So we don't need you to be immune to it during the summer months because it's very, very rare for anyone to ever get the flu during summer months. So yearly for people over 65 and older, and even yearly in people younger than 65 with other illnesses. And like I said, a lot of the other illnesses have to do with your immune system itself. There's a lot of disorders of the immune system, and if you should definitely speak with your doctor if you fall in any of those categories to get immunized younger than 65. And also, just FYI, pregnant people that are going to be pregnant during the flu season also should get vaccinated too. I should say not pregnant people, but pregnant females, right? All right. Okay. Now so that's influenza. Now we move forward to tetanus. Okay. Tetanus, also commonly known as lockjaw. Okay. We don't commonly use that name anymore, lockjaw, because so many people are more familiar with tetanus. But definitely, I just want to make sure that everyone knows what we're talking about. And basically, it is a bacteria that is found in soil, dust, manure, rusted old metal parts, old things old and dirty things, okay? This bacteria likes to live in. And what happens is you cut yourself or you poke yourself with something, commonly like a rusty nail, okay? And the bacteria gets penetrated through the skin. And for those that aren't vaccinated, the bacteria then grows, okay? It proliferates. And what happens, and it proliferates because your immune system doesn't recognize it right away, so it takes time for your immunity to build. By that time, the bacteria is so much that it takes over. So the reason why tetanus is so important is because look at this third bullet point right here. Can be fatal in almost 20% of people infected. Okay? So that's huge, numbers-wise. And that's why it's always recommended that we get the people informed. If you ever get a cut, the first question a doctor is going to ask you, maybe not the first, but the question they're going to ask you is, when was your last tetanus shot? Because if it was outside it more than 10 years ago, you just bought yourself a tetanus shot. Okay? And they do recommend vaccination every 10 years. Is that a hard and fast cutoff rule? No. Okay? If someone comes to my office with a cut, we stitch them up, and they say, and I ask them about that, they say, well, Doc, I'm not really sure. I know it was several years ago. I say, well, better safe than sorry. Let's get you vaccinated again. Okay? So that's tetanus here, but it's a very, very fatal illness, a very toxic bacteria that we really want to make sure we're all vaccinated against. And then the big elephant in the room here, Zoster, shingles. I get a lot of questions about this because pneumonia we've all heard of tetanus, we've all heard of, influenza, the flu, and now people are starting to realize shingles, okay, or Zoster, or herpes zoster, okay? And I know herpes throws a lot of people off because they think of the sexually transmitted disease, but it's far different. Completely different virus, okay? A different strain of the virus. So this shingles, and I want to describe the presentation first, and then some of you have had it, And those of you who haven't had it don't want it. So we're going to try to prevent that from ever happening. So shingles is caused by Varicella-Zoster virus, and it's the same virus that causes chickenpox. And that's right, chickenpox, when we commonly hear of it in infants, right, where they have the little bumps and they're scratching themselves and they're contagious to their brothers and sisters and friends. They have to stay home from school, so they think they're having a mini vacation. That is the one that we're talking about, and a lot of people don't remember if they have had it or not, okay? And that's fine, because I always say, like I said, we're better safe than sorry. Then what happens is that virus, that chickenpox virus, gets in the system, lays dormant. Virus stays dormant in the body in the inactive state for years, okay? 40, 50, 60 years. And then one day, actually, what happens is your immune system gets suppressed for one reason or another, whether that being stress, whether that being medication, whether that being other illnesses. For whatever reason, your immune system gets suppressed and it reactivates. Okay? And it reactivates, and it's very typical on how people present with it. Mainly, it is a rash. Okay? It is a very painful rash. Okay? And it is a rash that is characterized by staying on one side of the body, only half of the body. So it'll start straight from here and wrap around to the middle of the back, not extending to the other side at all. Rarely does it, but most commonly, I would just say as a general rule of thumb, it doesn't cross to the other side. One side wrap around back to the other. And the reason why it does it is because it follows nerve paths. And from the spinal cord, we have nerves that come out both sides, and the nerves don't cross over. The nerves just kind of stay to each side. And then it presents as a rash, very, very painful. In fact, I've seen people that the rash is all gone, years later they still suffer from this pain, believe it or not. Okay, that's why it's such a big deal. Now, it's a viral infection, so they also feel out of it, they feel fatigued, lethargic, not eating well, same as any other viral illness, okay? But this rash is very, very typical of the shingles that people get. Now, how common is it? Well, almost 1 out of every 3 people in the U.S. will develop shingles if they don't get vaccinated. That's why there is a big, big push. So I use a common thing. Look to the person to the right and to the left of you. One of you guys is going to get shingles. And imagine if you guys all got immunized, you have just decreased that drastically. Okay? Now, about half of all cases occur among men and women 60 years or older. So what does that tell us? When should we get vaccinated? 60 years or older. But people who develop shingles, say for instance they weren't educated, they didn't know, or for whatever reason they didn't get it, people who develop shingles typically only have 1 episode in their lifetime. So it's questionable whether they should be getting the vaccine or not. Some people still opt for it, which I'm fine doing, okay? But definitely we'll have that conversation with your doctor if that's most appropriate for you. And because rarely does it happen, but it does happen, that people can have a second or even a third episode of this painful, painful rash. Okay? So it is recommended that people 60 years or older get the single-dose vaccine. And if you get it through your pharmacy, it'll be covered through Medicare Part D, the drug plan. And you can easily get it done at the pharmacy or at your doctor's office to get the actual shot. Okay? But the actual vial you should pick up from pharmacy if your doctor doesn't have it in their office. But again, very, very important. Okay. So those are the big, big heavy hitters for the immunization and vaccinations. If we can focus on just these 4 major ones, I think we've done a world of difference for ourselves or our loved ones or our friends and family that we can give this piece of advice to. Again, there's a lot of myths out there about other ones, about some of the vaccines. But talk to your doctor, have that open conversation with them as to what's appropriate for you. I don't like making generalizations because it's so important that we treat everyone as an individual with a certain set of issues and make sure that we cater to everyone as an individual. Okay, so I encourage you taking this information and learning from what we talked about here and bring that into the physician's office. But I still want to comment a little bit and talk just a little bit more about some common tips that we can kind of go over for the upcoming winter months, right? I mean, I know we're all enjoying the beautiful weather, or I hope whenever anyone is watching this, it's still beautiful out. But inevitably, we live in the Chicagoland area, and winter is inevitable, right? So for that, I want to go over some just general guidelines, okay? Some general points of how to stay healthy throughout the winter months, okay? And if you look at my number 1 here, as basic as that may sound, it is probably the number 1 thing that you can do to prevent yourself from getting sick. As basic as that is, washing your hands often. Because a lot of these viruses, okay, a lot of these illnesses are hand-to-mouth contact, okay? And we may not know it, but then we eat something and we don't wash our hands, we shake hands, we touch tables, things like that, that really what we need to do is, if we wash our hands frequently, we don't have that contamination then, okay? And so that's very important. Now, staying warm is important for a couple of reasons. Mainly because, and a lot of people don't realize it, but as we grow older, a couple of things happen. First of all, we lose our muscle mass. Muscle mass decreases, okay? That's a given. Remember when you were cold and you start shivering, right? Well, that is a sign that your body's trying to warm up, keeping that internal temperature warm. But that shivering is caused by muscle contractions. And if you don't have those muscles anymore to keep you warm, well, you can easily be affected by hypothermia, a decreased temperature. And that's a big, big deal, because if your temperature goes down too low, the electrical current in the nerves, especially the heart, can go haywire, slow down, speed up, and that can cause an abnormal heart rate, things of that sort. So it's very, very important to make sure we stay warm. And also because our blood vessels don't respond as appropriately as they used to help contract and keep the heat in, okay? Other thing is manage stress. I mentioned stress being a big thing in making sure that we, in our immune system and keeping our immune system high. Well, believe it or not, if you're in a high stress situation, whether that being sleep deprived, starved, family emotional stress, financial stress, anything of that sort, actually has a role with how you feel in your body and things that go on, and that can make you feel, or that can suppress the immune system, and you're more susceptible to even these illnesses that we just spoke about. Okay? Travel safely, especially in the winter months, especially here in New Lenox and Chicagoland area. We get snow, we get ice, and we all try to be as active and traveling as much as we can, but make sure we always do that in a safe and effective way. Even if that means carpooling, okay, that's always a good idea, or public transportation for that matter. Definitely try to prevent injuries, be safe, use assisted walking devices if we need them, okay, especially like we mentioned with ice and snow. The last thing we want is someone to have a fall and God forbid, break a hip or hit their head. Those are serious, serious things that we need to really worry about. So definitely try to prevent injuries by using an assisted walking device like a cane or a walker if need be. Eat healthy, be active. Just because it's cold outside doesn't mean we have to stay indoors and sit in front of the TV doing nothing. There's plenty of indoor activities around the community that you live in, especially with the Park District, the library. Very, very important to still get out there and be active and an active member in the community. And then the last thing is get checkups and vaccinations. I guess that kind of hits home to exactly what we spoke about through this presentation today, to really make sure that we talk to our doctors regularly with the regular checkups, even if we're doing well, believe it or not, because common screening questions can come up that you never even thought about, and your doctor may ask those and, open up, a can of worms that we want to make sure we want to work up thoroughly, okay? But also having that conversation with your doctor about vaccinations. And that's it for me, but I really want to, really thank you guys for coming out today. It is very important that we get, as a community, come together to get educated, to keep all of us safe, especially with the winter months coming up. I know we're all having a great time with these summer days, but let's make sure that we continue that in the winter, okay? All right, thank you guys very much.